Hello and welcome to the James Button & Co training video. My name is Jayne Foxley and I'm a solicitor with the firm. I'm joined today by James Button, who is the principal of the firm.
Hello.
Right, James, I understand that there have been some changes recently in relation to the Public Health Control of Disease Act 1984, and these are quite significant. Are you able to explain a bit about those changes?
Certainly. The 1984 Act has existed for a quarter of a century and has provided rudimentary control over communicable disease control. We now have wholesale change with some very clever ideas brought in under the Health and Social Care Act 2008. And that is going to enable local authorities, who are the organisations that hold these control powers, to seek court orders which will actually, in extremis, address the needs of society as a whole when you have people who are infected or contaminated and are not taking proper precautions to prevent the spread of that infection or contamination into either the population at large, their families, their friends, a social circle, workmates, whatever it might be.
I see, so this is a significant extension of the local authorities' control powers.
Absolutely, yes. It's what people have been asking for the best part of 20 years, and finally we've got it.
Got it, I see. And are there any changes in respect of the notifiable diseases?
There are. The idea of notifiable diseases still remains, but they're now created under the regulations rather than under the Act itself. But
Right.
the idea is still there that registered medical practitioners, that is doctors to you or I, who are attending a patient who they suspect is suffering from a particular disease as defined in the regulations, must notify the proper officer of the local authority, but for the first time we have a time scale for that as well, and that has to be within 3 days.
I see. So is there also some system of laboratory notification as well?
Yes, this is one of the big changes, that diagnostic laboratories where people have tests sent off, blood samples, stool samples and so on and so forth, where they're sent to, that's one of the first places where diseases are picked up, and there is now a statutory requirement on them, or rather there will be in October when they're brought into the frame, on them to notify the proper officer as well. So we have a system where notification in its entirety will hopefully improve, with the result that the surveillance and the detection can then improve, leading on to, we hope not very often, the use of these control powers.
I see. Thank you very much, James. That explains it very well. Thank you.
Good. Thank you very much.